Hi, to the slings, slow flow and massage sequence. For the next sequence, we are using a ball. Our preferred ball is a massage ball. It's fairly soft, not super soft, but definitely not hard. So anything along these lines of a prop is good to use. So it could be a toning ball or any other ball really you prefer in that size. In terms of anatomy trains, we will be focusing on the deep front line and the lateral lines. The movements are supported by the superficial front line and the superficial back line, and of course I'm layering in the spiral line. The myofascial training techniques we apply are aiming for glide, elastic strength, but also a softening all around the hips. There is strength included, but should be a very nice blend of mobility, release and tone. So from the low kneeling position, you can sit to your left, take the left leg to the front. As always, Lucas and I will be mirroring you. So that's it. With the left leg in front, the right leg back. If this is really uncomfortable for your knees, you can sit elevated on a firm cushion if you like. From here, take your arms out to the side, reach long, take your arms overhead, and then rotate to your left, so spiraling around. Lift the right hip, let the breath flow, and hold the position. This is called basic hip opener. So we'll go into this position more dynamically with the next exercises, but for now we hold it slow. So pelvic floor abdominals are engaged. You're drawing inwards and upwards. The hip extensors are engaged to a good measure, not gripping, but also not being lax. So 50-50. If that's your internal sense, that's really good. 50 front and 50 back. Actively lengthening the hip flexor muscles, drawing inwards and upwards. The spine is rotated. There is a little bit of lateral flexion, but you want to keep it as long as possible. The front of the rib cage softly closed. Take your right arm overhead. So reach even longer. Your sense is length from the knee along the side of the body, the shoulder all the way up to the fingertips. Relax pelvic floor, abdominals, hip extensors, and then you're coming back into a centered position in Z-sit. Inhale. Exhalation into the basic hip opener, engaging fully. Inhalation back into Z-sit, release. Exhalation, hip opener, engaging. And then the contrast, slowly release pelvic floor, abdominals, hip extensors. We go one more time. So actively opening the front of the hip and then center, active dynamic pelvic floor. From here, inhale. Exhalation into a round back. So tilting the pelvis back, draw back from your abdominals. Inhalation, open. We do that 2 more times. We are aiming for glide within the quadriceps. So the knees are bent, and then the hip joint from flexion is opening up. One leg is more externally rotated and one is centered or medial. One more time. Now I'm adding on. Rotate your right, open, lengthen. Exhalation into a round back. One more time, twist. It's a counter twist, pelvis and thoracic spine. Changing direction, exhalation, round back. Now we're going to the left. Lift your right sit bone, open, reach. Exhalation, round back. Inhalation to the left, one more time, your basic hip opener, rotation, exhalation, round back once to the right, center, counter spiral, round back, gliding, rolling back, an open spiral, basic hip opener, and then to the center, round back. Open your arms, center your spine, elongate, let the breath flow, and lower your arms. So from here, take the ball, place the ball underneath your right sit bone, or actually a little bit to the outside of the left sit bone. So the ball is underneath the left side of your pelvis, a little bit to the outside of your sit bone. Now the right side of your pelvis, let it sink. So let that sit sit bone sink, and then elongate the spine. Reach from the crown of the head. Take your arms out to the sides. We're going into the lateral lines. So with your next inhalation, reach into a side bend really long. With your exhalation, spiraling down. The hand is leading, left hand towards the right. And then lift your left arm up, active long side bend, a domino. You lower your left arm, the shoulder follows the spine, and now it becomes more dynamic to a centered position. Slow inhalation into an active long side bend, spiraling around. The shoulder follows the hand, the rib cage follows thoracic rotation. Take your arm up, lateral flexion again, side bend, domino. The arm lowers, the shoulder follows the head, the spine. Right lateral line lengthens, recoils. Upper portion, of course. Inhalation, side bend. Spiraling around. So in movement, the lateral line is also a line of rotation. Lift your arm back up. This is the domino. So you lower your arm, you let the spine follow. Elastic lengthening right, recoil. And then take your arms overhead, reach up, lengthen both sides of the body. Lower your arms, keep the length. Exhalation, round back. So you're tilting back, rolling. Counter spiral to the right, opening and rotating. Exhalation, round back. To the left, hip opener, hold it. Place your left hand to the floor, the right, and roll a little bit to the outside, or you're rolling over the ball, so it's a little bit more on the outside of your hip. The hands are on the floor, about parallel to the thigh, and then you can rotate your shoulders slightly inwards, open to the chest, collarbones wide apart, and now you're reaching around, or you're twisting around to your left. So your sternum is facing the floor, the gaze of the eyes is facing the floor. Bend your elbows lower, it's a twisted push-up in Z-sit, and then exhalation, press up. Inhalation, lower down, keep the head centered for now, and then pressing up. We do that one more time. Lowering down, elbows are reaching out wide, and then pressing up a little extra. So you're reaching out with your left elbow, turn your head to the left, push up with your left, and then you're derotating a little bit. Lower, reach out with your left elbow, look to the left, you increase the rotation, push up with your left hand, and it's a little bit decreasing the rotation. One last time, long spine in that twisted position, pressing up, and then from here, you're moving your left forearm onto the floor. You are taking the top leg out, extend it, and then take it forward, place your front foot to the floor, and extend the lower leg out. So you're now balancing, or you're lying on the ball with your left leg relaxed on the floor. Now for this next massage sequence, so it's setting a stimulus. It's not per se to release anything, definitely not to stretch, but it's a nice stimulus. So we are moving slowly. I want to go quite deep, so this leg needs to be relaxed on the floor. And then it's a zigzag pattern. So first, roll the body over the ball, forwards and backwards. You can move as slowly as you like, or you can join Lucas and me in the pace we're moving, and you're zigzagging down your IT band. So rolling forwards towards the quadriceps, and then you're rolling back towards the hamstrings, and it's a slow zigzag pattern. The lateral line is a line of space. So we are looking for length in, or space, width in the lateral line. So zigzag towards the knee. And then when you're close to the knee, you stay a little bit in front. So you're kind of on that front edge of the IT band to the quadriceps, and then you're rolling up really slowly. So whatever edge you feel is the right edge, stay on it and roll up very, very slowly. The left leg stays as relaxed as possible, and it's like a wave. You're pushing up through the movement of the ball. So it's actually quite a nice feeling. Slowly rolling up towards the ASIS. And then, not quite reaching the ASIS, so we stay a little bit lower, and then you're rolling to the side. So once again, you're coming into a side lying position. You can place your foot on the floor, and then you can relax your upper body, either extend your left arm or bend it, whatever suits. You can also place something underneath your head. So in a side lying position, the right foot is either on the floor or the cushion you had before. If you had one, you can place the knee on that cushion, so whatever suits your body best. Find the right spot for the ball. You want to feel you can lie as centered as possible, a little bit underneath the greater trochanter, so the side of the hip there, and then lengthen the bottom leg away and lift it up. And then with your inhalation lower, so an adducted leg lift. The lower waistline stays lifted. So we want transverse abdominals there engaged, also a little bit of obliques to maintain that lift. In terms of the lateral line, the top portion stays engaged, and of course the lower portion there is actively lengthened by engaging the adductors. Keep the leg lifted the next time, and then extend back. So you're extending the hip, it's a shift, and you take the leg to the front. You exhale when you shift the leg back, drawing up from pelvic floor abdominals, inhalation back. So you have all the adductors working. We do 2 more shifts. However, our focus is on adductor magnus, that is also a hip extensor. So really engaging that one with adduction and hip extension. From here, it's a double leg lift, and you can use an accentuated breath, like a percussion breath. So inhale, lower the leg, and then up for 2. We do that 2 more times. So every exhalation is fully engaging pelvic floor abdominals, lifting the leg a little bit higher. 1 more time. And then lower the leg all the way down. Relax it and just roll forwards and backwards over the ball. And then you can roll off the ball. Take the ball away from underneath the side of your hip. Place it out of the way. And then relax your top leg down. So from here, lift your head, lift your shoulder, and place your hand, the left hand, behind the head. With your hand, use it wisely, so lengthen the back of the neck a little bit. Your right hand goes to the front of the chest. Now we are aiming to keep the legs as relaxed as possible, using triceps here, shoulders to stabilize, and lateral line on that top side. So hand on the floor, inhale, and then exhalation, pushing up, lift, inhalation, lower. Exhalation is a lift, so keep your shoulder back and down. You are drawing back from the head of the humerus back into the shoulder joint, and of course the triceps here is doing the main work. Lateral line hopefully is joining in on that right side. Keep the lift. Place your left hand on the floor and then push up, turn your right leg out, bend the left knee, and you are in tailor sit. So let's do an experiment here. Take your arms out to the side. See how that feels. Take your arms overhead and then spiraling twist to the right. So you inhale, lower your arms to shoulder level, rotate. Center the body, exhale, arms overhead. Inhalation to the left. How is this rotation back to the center in comparison to this one? And exhalation back to the center. Let's do 1 more. Inhalation, spiraling twist. And back to the center. Keep your arms centered, keep your upper body centered, lower your arms, round back, exhalation. How does that feel? Right, left. Inhale, open, and relax your arms. So we are changing side. Take the left leg back, sit. Right leg in front, left leg back. And we start exactly the same as we did before. Arms out to the side and then overhead. Spiraling twist. Place your right hand onto the floor and hold. Lift your left hip off the floor. Draw up from your pubic bone. Tilt the pelvis back. So the sense is a posterior pelvic tilt, like a pelvic curl on the floor. Abdominals, pelvic floor engaged, hip extensors engaged. 50-50 feeling is a good feeling. The front of the rib cage is softly closed, left arm overhead if you like. So you are reaching from the knee to the fingertips. And then with your next inhalation, lower your arm, Z-sit, relaxing pelvic floor, abdominal, spine extensors take over. Exhalation into a basic hip opener. Inhalation, swinging back. Exhalation, basic hip opener again. So it's an even, gentle rhythm. We go one more time. And once again, our aim is to actively open the front of the hip, lengthen the hip flexors, hold it. Exhalation, rounds back. Very different here. Inhalation, open and lengthen. Exhalation, curling back. So this is more about glide close or all around the front of the hip joints. Round back into a twist to the left. So counter rotation, pelvis and thoracic spine. Round back. Inhalation, centering the pelvis, rotating the thoracic spine. Exhalation, round back. We are going to the other side. To the right. Basic hip opener, lifting and spiraling, and then lowering, centering, tilting back once again into a spiraling twist, basic hip opener, round back, once each. Opening up, counter spiral, and then soft round back, yet strong. And an open spiral. And a round back. That was the last repetition. Open your arms, keep the spine centered, and now elongate. Lowering arms all the way down, going more into the lateral line. So take the ball, place the ball underneath your right side of your bottom, so a little bit outside of the right sit bone. Let the left sit bone relax. If you're used to work with pelvic floor active dynamically, you let your pelvic floor relax completely. You let the deep spine extensors elongate the spine. So we are aiming for a softening in the deep front line, all inside the pelvis. So obturator internus there, deep lateral rotator included, let it soften. Arms out to the side, lengthen, inhalation mermaid. It's really long. Lateral line is opening. Exhalation is spiraling. The arm is leading. The shoulder blade follows. The rib cage, the thoracic spine. And then lifting the arm up. I could take this hand, the left one, off the floor at any time. And now it's the domino. So one body part takes the other, takes the other. The left lateral line is elastically lengthening, recoiling. Inhalation. This is active and controlled, a muscular focus. Spiraling, glide in the shoulder blade, mobilization for the ribs, the thoracic spine. Lifting back up, the lower lateral line is working. Domino, allowing to happen, and then elastically stretching, left lateral line recoiling. Minimal effort. So there's contrast within this sequence, and there is an alternating focus on more muscular work, on allowing, so letting the body weight take over, and then on myofascial or fascial elasticity and recoiling. Take your arms overhead, lengthen the side body, lower your arms, keep the length, and then exhalation into a round back. Glide. Counter spiral to the right. Open and spiral, lengthen. Round back, exhalation. You are rolling a little bit over the ball. Inhalation. Oh, this is the counter spiral right then. So one bonus spiral here. And then we're going into a hip opener. Good. So lifting the left sit bone up, right hand to the floor, left hand to the floor, and you can roll over the ball a little bit. So the ball is rolling to the outside of the thigh, hands on the floor, about the same line as the thigh. Then you can turn your arms inwards a little bit, the hands maybe a bit wider or just shoulder distance apart. So we are aiming for length in the spine in that rotated position. Lower down, bend your elbows, keep the gaze of your eyes focusing down, press evenly with both hands. Inhalation, lowering down at the same time, reaching out with the elbows, pressing up. Pressing up with the outer edges of the hands. We're going down one more time, yet keeping all of the 10 fingers relaxed on the floor, pressing up. Tiny little adjustment. You're looking to the right, you're reaching out with your right elbow, and then you're pressing up with your right hand. It's a little bit derotation and increasing the rotation to the right by reaching out from the right elbow. And then as you press to the right hand, decreases the rotation one more time. So once again, we are setting a bit of a stimulus here on the side of the hip with the ball, strengthening arm lines in a different way, maintaining the rotation. So strengthening the spine extensors and deep rotators in a different way. Take your right forearm to the side of the body. Extend your top leg, the left leg, out to the side. Take it to the front, place your foot on the floor, and then slide your bottom leg out so it's in line with the hip. And then from here, slowly again, so you can position the top foot as you like, keeping the bottom leg, the right leg, as relaxed as possible. You zigzag down your IT band. You can do it as slowly as you like. You can pause if you find a spot where you feel, need a bit of pause, let that sink a little bit deeper. You let it sink a little bit deeper. So we get that sense of width in the IT band. That's part of the fascia lata, wrapping all around the thigh. We are going to the borders and across the quadriceps, and the same with the hamstrings. So giving the lateral line that space and a sense of width. And then when you're close to the knee, find that edge, one that's really good for your body. You can relax the top leg, the border of the IT band and the quadriceps, and then you're rolling up really, really slow, keeping the right leg on the floor relaxed. The more relaxed the leg can be, the deeper you sink. So we want to take any stretch tension or contraction tension out of the muscles and just let that prop sink really deep. Set a deep stimulus as we are rolling up. So giving a sense of lift. As we are rolling downwards. So rolling down close to the groin, and then from there you're rotating or you're turning your body to the side just a little bit. You need to maybe maneuver around a little bit below the ball, below the greater trochanter, the head of the femur. Then you can lie down on your side. Once again, you can place your foot on the floor like we do, or you can place your knee down onto the floor or another prop, like a ball or a pillow. So from here, engaging again, pelvic floor, abdominals, the lower waistline is lifted, reach out with the bottom leg and lift, inhalation, lower. So an adducted leg lift, and the sense is reaching out away from the hip joint and then lifting up. It's like a semicircular feeling. Now you're bringing a lot more stretch tension in that tissue of the abductors and of course the fascia around. So different stimulus when you're engaging adductors. The next time, keep the leg lifted. And then exhalation, take the leg back. It's a shift, hip extension. And then taking the leg back into alignment. Exhalation, you take it back. And it's that counter action. As the leg is moving back with the exhalation, the pubic bone is drawing up, especially at end range. So by sense, I want to open my hip joint in two directions, from the pelvis up and from the leg back. Keep the leg aligned, lower it down, double percussion breath, double lift. Do that 2 more times, shoulders relaxed, deeply engaged abdominals, adductors working. Go 1 more time. And then lower your leg down, let it relax. Let your adductors relax, but also the tension gets out of the tissue of the side of the hip. Can roll forwards, backwards a little bit, and then just slide off the ball. Take the ball away from underneath your hip, place it wherever it's out of the way. Then you can relax your top leg. Reach out from your bottom leg, so the extended leg is reaching out wide. Lift your forehead, shoulder, place your hand behind the head. The left hand is in front of the chest. Triceps, shoulder, lateral line here, top part of the lateral line on the left side. Inhale to prepare. With your next exhalation, lift. So you're pushing up, inhalation, lower down. Lifting up and lowering down. You can do as many as you like. You can pause if you like. We do that 1 more time. The important thing is the shoulder needs to draw away. 1 more hold. Triceps working, lateral line working, right hand to the floor, and then push up. Slide your right leg to the front, open the left leg, and you are in tailor sit again. So from tailor sit, take your arms up towards the ceiling, lengthen the side of the body, and then inhalation to the left into a spiraling twist. How does that feel? Exhalation to the center, inhalation to the right, back to the center, open your arms wide, lift your sternum, lift the gaze of your eyes, long extension into a round back, really soft arch, big, and then open your arms, center the head on top of your spine, and relax your arms. Thank you very much.